So today let's talk about what you should expect from your aesthetic injector, your aesthetic provider. It varies very much by state, so I do always like to tell people that what's legal and kosher here in Iowa is not necessarily the case in California, Florida, Texas. So it's always best to check where you live. Here in Iowa, you should obviously always be going to a trained medical provider. Please don't ever go get your Botox or your Dysport or any medical procedure anywhere else. It needs to be sterile, it needs to be clean, there needs to be certain things in place to just keep you safe. We are still practicing medicine. I will say this over and over again. You will get tired of hearing me say this. My patients frequently get tired of hearing me say this, but I'm still practicing medicine. So it's no differently than me practicing medicine in the emergency room and urgent care. I am still practicing medicine, and with that becomes an ethical responsibility to you, and just a lot of background noise that you guys may not realize. Just because we're making you beautiful, making you feel good, and we're not practicing at like a trauma level 1, we're still practicing medicine, and it needs to be done safely. So for you all, what I like to tell you, your aesthetic injector should be a registered nurse or a nurse practitioner, doctor, someone with a medical degree, a background in medical anatomy, physiology, medications, things like that. It should also be someone who's attended an advanced training for particularly Botox, Dysport, filler if they're doing filler, microneedling if they're doing microneedling. Usually they'll have certificates to show you if you were to want to see them. They have been to many advanced trainings, and that's where this area of medicine really kind of branches off from anywhere else. Usually you go to medical school, do a residency, and then you go immediately into practice. Well, you may decide 5 years down the road, you don't maybe want to do family medicine anymore. You don't want to do emergency medicine. So you go back and you do another fellowship or residency in gastrointestinal medicine or some other area of medicine. But you still go back and you have to do that other area and get certified before you can practice that area of medicine. With aesthetic medicine, you can get that certificate and you can just take a 2-day class and you could start injecting people's faces. That's great. But like any other area of aesthetic medicine, you need to have continuing education. Your provider should have continuing education. I am never offended when my clients come in and they ask me, so Liz, where have you trained? What have you done? Who did you train with? And it's a lot more difficult to find great trainers in aesthetic medicine because it's an emerging area of medicine. So I've learned from many amazing doctors in the Cedar Valley, in the emergency room, in urgent care settings, in the hospital settings and clinic settings. It was great because they were right there. I didn't have to work very hard to gain from their years and years and years of knowledge. And each one of them had a little pearl I like to tell people that I could pick from. And then you take those all together and that's how you give the best care. With aesthetic medicine, these people might be in Washington, D.C. or California. And so you fly to them and you take on that responsibility when you get into this field. So you fly to them, you get that continuing education, and then next year something new comes out and you do it again. And then next year something new comes out and you do it again. So there's always additional training, and your provider should be able to tell you that. You should be able to ask them not only what certification course they took, if they took a certification course, but where they have been training, what their upcoming trainings are. Have they done a cadaver course? This is something that really I had heard so many times and I never really understood. We get a lot of anatomy in school. What do we need a cadaver course for? How is that helpful? When you are injecting products into someone's face that can have any sort of a complication or a side effect, you need to see their underlying anatomy. You need to see the tissue. Everybody's anatomy does vary. That's absolutely true, but we need to know and be very aware of the complications we can cause and how to correct them. You should also be asking them if they haven't taken a cadaver course when they're planning to, do they have reversal agents on hand? So there's certain things that we do in the office that have a reversal agent, and they should be having that on hand in plenty of volume for any adverse effect you may have. Do they have a crash cart? That's something that they should have. Yet again, we're practicing medicine, so these things need to happen. Don't be afraid to interview them. Don't be afraid if you just don't match up, your personalities don't align. That is totally fine. It's no different than choosing a doctor, choosing a babysitter, choosing a lawyer, choosing anything that you have to connect with that person. This person's going to be taking care of your face that you should feel comfortable reaching out to them if you have any issues and that they could manage those issues. And you should be very comfortable with asking questions of them. So it will never offend me personally if somebody comes in and they just don't mesh well with my personality. That's okay. I'm not like, I tell my husband this all the time. I'm not everyone's cup of tea. I'm glad I'm his cup of tea, but I'm not everyone's cup of tea. And I don't need to be everyone's cup of tea. But if you are looking for something other than what I can give you, I'm happy to also give you other names, other recommendations. It's a small community and we know each other, but don't be afraid to ask questions and don't be afraid to be picky and selective with who's touching your face, please. Thank you.